Curious about the connection between knee pain and arthritis? In this video, we uncover 5 key reasons why knee pain can eventually lead to arthritis, so let's dive into this. Wait, before starting the video, we introduce you with Joint Restore Gummies, which will help you to relieve knee pain naturally. For more details, click the link in the video description below. Reason 1. Joint injuries. One of the primary reasons knee pain can lead to arthritis is the presence of previous joint injuries. Traumatic injuries such as fractures, ligament tears, or meniscus damage can disrupt the joint structure and increase the likelihood of developing post-traumatic arthritis over time. The wear and tear resulting from untreated or poorly managed injuries can lead to the gradual deterioration of the joint cartilage, ultimately contributing to the onset of arthritis symptoms. Reason 2. Cartilage deterioration. The gradual deterioration of knee cartilage is another significant factor in the progression from knee pain to arthritis. Overuse, aging, or genetic predispositions can contribute to the breakdown of the protective cartilage within the knee joint, leading to bone-on-bone contact and the development of osteoarthritis, the most common form of arthritis. The loss of cartilage cushioning results in increased friction and inflammation within the joint, causing persistent knee pain and stiffness, characteristic of arthritis. Reason 3. Inflammation and overuse. Chronic inflammation and overuse of the knee joint can also pave the way for arthritis to manifest. Conditions such as rheumatoid arthritis or repetitive stress injuries can trigger persistent inflammation within the knee joint, accelerating the degeneration of cartilage and leading to the progressive development of arthritis symptoms. Continuous strain and overuse, particularly in occupations or activities that involve frequent kneeling, squatting, or heavy lifting, can contribute to the breakdown of the joint's structural integrity and increase the risk of arthritis. Reason 4. Alignment issues. Poor joint alignment and biomechanical irregularities can play a significant role in the connection between knee pain and arthritis. Misalignments such as bow-leggedness or knock knees can result in uneven distribution of weight and pressure within the knee joint, leading to uneven wear on the cartilage and an increased susceptibility to arthritis development. Addressing alignment issues through orthotic interventions and corrective exercises can help alleviate knee pain and reduce the risk of arthritis progression. Reason 5. Genetic factors, genetic predispositions, and hereditary factors can influence the likelihood of developing arthritis in response to knee pain. Certain genetic markers and family history of arthritis can predispose individuals to a higher risk of developing arthritis, especially in cases where knee pain persists or is exacerbated by external factors such as lifestyle or occupation. Understanding one's genetic predispositions can aid in early intervention and proactive measures to manage knee pain and reduce the impact of potential arthritis development. Where to get the Joint Restore Gummies? Get Joint Restore Gummies from official website. Click the link in the description below. Thanks for watching. Don't forget to subscribe, like, comment, and share. Until next time, stay tuned.